good morning. This is Dr. Frank Vittimberga. I'm here at Living Well Med Spa in Fort Lauderdale, Florida. You can reach us at livingwellmedspa.com or at 954-999-0257. We're here looking at some questions about Coolsculpting from Real Self today. As you know, if you followed us, that we're very involved in Coolsculpting. It's a great procedure to really sculpt the body. But there's always a bunch of questions on Real Self, which is a great resource to go to for more information about any aesthetic procedures. So the first question we'll dive right into is, I'm interested in getting Coolsculpting to even out my stomach. Can I get Coolsculpting while I'm still losing weight? Well, that's a great question, you know, and as I said, really Coolsculpting is a sculpting technique meant to really finally pare down fat cells, and so it acts actually independently of weight loss in terms of you can still lose weight and get the results from the sculpting. Is the sculpting will reduce the actual number of fat cells. Now, the opposite is not true. If you do gain a lot of weight, then some of the benefits that you get from Coolsculpting may be lost if you start to gain more fat cells. But we do see the benefits with, you know, on the abdomen, the stomach, to help smooth it out. These pictures, you can see after 3 months you get a nice transition from kind of a rounded lower abdomen to nice and flat. And in this patient, this is a patient who had actually liposuction previously and ended up with some irregularities. That's one of the problems you can get with liposuction, is you get irregularity of the area that's been treated. Not for everybody, but you know, obviously we've had people come in with concerns regarding post liposuction, and it is amenable to treatment with Coolsculpting as well. For the abdomen, for when you're in weight loss or at a stable weight, it's a great procedure. So we'll move on. We'll look at another question here from Real Self. Do your measurements, parentheses, waist size, etc., change after Coolsculpting? Can the area directly under the breast be treated? Another great question. So again, we'd expect that you'd have sculpting of the areas where, you know, particularly if you do areas like around your waist, that you would lose size in terms of the actual size, although it's not necessarily will make you lose a lot of weight. When you look at the areas that are getting sculpted, the actual amount of fat may not amount to a large amount of weight. It doesn't get distributed to other parts of the body, but again, you won't see significant weight loss just by doing Coolsculpting itself, but it will kind of redirect and shape the area in a finer way. So we would expect you to see some reduction. In terms of the breast area to be treated, there are, you know, the area above the bra line, where some women have fat that will come kind of over the top of the bra, or the area underneath the bra, are both amenable to treatment with Coolsculpting. Again, we'd expect you to get good results with that. You know, I think those are prime areas to really sculpt the body. Let's see, moving on. Are there areas of fat that are more resistant to Coolsculpting than others? This is another great question. You know, again, not every area is going to be amenable to Coolsculpting, and sometimes, you know, we can tell in advance that those areas might be a little bit more difficult. Now, in general, if you have an area that's amenable to it, then you can usually get a really good result with one treatment. Sometimes some of these more resistant areas that are more difficult might take an additional treatment to get the adequate response that you want. So when we look at the belly, you know, really it's the subcutaneous fat, the fat that's right under the skin that's amenable to it, not the visceral fat. So a lot of guys that walk around with the keg instead of the beer belly, you know, instead of the six-pack, that fat on the inside of the belly is not really as amenable to treatment with Coolsculpting. Generally, it's the fat that you can pinch and kind of put between your fingers, because that's the fat that's going to be able to be sucked up by the applicator, and you're going to be able to really freeze that well and get a good result with one treatment. Some of the areas that are a little bit more resistant are sometimes the inner thigh area, where you may have a fat that is amenable, but it's just not, you know, as pliable and as able to be sucked up into the applicator and to get a good freeze on it. So it depends on the location and it kind of the constitution of the fat. And as I said, it's really for the subcutaneous fat only, and not for the fat that's visceral or inside the belly. Let's see. I was told that I'm not a good candidate for Coolsculpting. Let's take a look. I'm fit but small in the area of the midsection. So she said that I may not be, she's not confident, comfortable since I don't have enough fat, and said if I get a horrible indentation, shark bites, they won't be reversible. So again, it really comes down to patient selection, really finding patients that have a good, a good contour of fat that's going to be able to fit in the applicator and get good results. Depending on the person, we can get to fat that's relatively not protuberant by using the smooth applicator. Particularly, a lot of very fit women will use that on their upper abdomen. You can also use that on the outer thighs. Again, amenable to getting good coverage in areas that might not be able to be sucked up into the applicator as easily. But on the other hand, this is an experience-based process, and again, I think good providers like the one in this case really are looking out for your best interest when they have a product to sell and they want to sell it. But on the other hand, they also want you to be happy with the results and able to move forward with that. So I think again, I think an honest and straightforward provider is going to tell you what they think is going to give you a good result. And they want you ultimately to be happy with the result in the longer term. So I think you have to go, you have to get evaluated, and then make that decision with the provider who actually can tell you whether you're going to get the benefit. And obviously they're in the business of selling products, so it's if they tell you it's not really the right thing for you to have, then I think you probably should listen to them. You're always welcome to get another opinion as well, but again, consistency and training across the board has been what kind of makes Coolsculpting consistent, and that they get results the same from place to place. All right, we'll take one more question from Real Self today regarding Coolsculpting. Let's see. What are the long-term side effects of Coolsculpting? So again, what we would expect to see with Coolsculpting is that you really shouldn't have many long-term side effects. Again, what you end up with is a reduction of fat cells on the order of 24%. Again, in the absence of growing a lot more fat or adding a lot of weight, you really wouldn't expect to regain those fat cells. You don't have really any recovery time in the short term. After you do the Coolsculpting procedure, the most uncomfortable part is the massage. You need to have at least a 2-minute massage after the applicator comes off, and that really significantly impacts the results. And that's probably, in terms of the short-term side effects, that's kind of where you get the most discomfort. Sometimes it's possible to get some bruising and tenderness there for the next few days. After that, what you'll see is that you get kind of numbness over that area, and that lasts probably 4 to 6 weeks. Not numb in the sense you don't feel it, but it just feels different when you touch that area. Those areas feel like that you really feel like something has been done, which again, ultimately I think it has been, and again, you see the results. But again, results with Coolsculpting take at least a month to see anything, and really 3 months to get the full effect. So don't expect to see anything before a month, and really it should be progressively improving until 3 months. Now, in the longer term, really, there are no significant side effects that have been reported. There is, in a very, very rare percentage of population, people will get a disparate response to the Coolsculpting. You actually get some hypertrophic fat production, so they'll actually gain fat in an area where they've had a treatment. Now, this is very rare, on the order of 1 in 10,000, but again, it's the kind of thing that if it happens to you, it's a big deal. And so Allergan, the company that owns Coolsculpting, is well aware of that possibility and stands by their product, and really will offer liposuction in that rare event if you do happen to have that condition. But it's again very rare, and it's a handful of people. It's not really something that you should worry about, or it should dissuade you from going through with the procedure. So I think that's all we have for this morning. Again, we're at Living Well Med Spa in Fort Lauderdale, Florida. Our number here is 954-999-0257, and our website is www.livingwellmedspa.com.